introduce myself again. My name is Jane. I am in my fourth year, and I'm in the Healthy Life group.
Uh, Hi everyone. Again, I am Perinath. I am doing masters, and it's been my 8th month in Canada, and I'm volunteering with Peer Health. I'm honored to volunteer with Peer Health.
Yeah, and today we're just gonna talk about some of the birth control methods, or like also known as contraceptives. And so when we talk about birth control, we're talking about like the practice of preventing an unintended pregnancy. And it is very important for like someone who might be um, um, pregnant to know about the options. And like for you guys, why do you think that that might be important? In what aspects might knowing about birth control options be important?
Family planning.
Yeah, that's for sure. Yeah. So like planning not only like when do you want to be pregnant, but at the same time also how many children you're planning to have, that all goes into planning your future. Anyone else?
Also, health reasons. For example, an unplanned pregnancy can be more risky
Yes.
for the baby, also for the mother.
Yeah, we want like the best like life choices for the mother, like for her to be able to choose what she wants to do with her life. And at the same time, we also care about the baby because we want them to have the life that the mother can be prepared to taking care of the child, that kind of stuff. Yeah, so like what I put here is like it is important for the mother's mental health, and also it is very important like in like healthcare as well, that you can inform the person of all of the available choices that they might have. And at the same time, like we were also trying to drive the message of um like you have the choice over your body, you can choose what you want to do with your body. And so the person that may become pregnant should be able to choose not only when to become pregnant, but also the type of birth control options that they're receiving.
I was just going to say too, I think for some religious reasons, some people choose a birth control method over a different one because of hormones and that sort of thing. So that's another.
Yeah, that's another important point. Yeah, and we have like the menstrual cycle right here. So basically from the time that the egg is developing to maturation, also like the ovulation, that is when it's released from the follicles, all the way till like when it's or it may or may not be implanted into the uterus, depends on if the egg is fertilized or not. And there is a method called like fertility tracking for as one of the ways that you try to like navigate through the days where like there's like different levels of fertility. But like this method, it is more important in like if you want to become pregnant, then it's a way better method rather than like a way to like prevent an unintended pregnancy. So yeah, like just like a really really watered down summary of like this diagram that you probably have maybe seen in your classes that you don't want to remember. Um, so like you have like two major players like estrogen and progesterone during the menstrual cycle. The estrogen really helps with like establishing the endometrium and the uterine lining. Through the first like day 1 to day 14, that's when the follicle is developing, and then like you have the ovulation, which is the release of the follicle, and then the you have like a switch between the two hormones into progesterone, and then basically progesterone is there to like protect the already established lining. So like what they always say is like estrogen establishes and progesterone protects. And so yeah, and you will see that like a lot of the hormonal contraceptives, they follow the mimicking of like estrogen or progesterone in a way that kind of like mimics that your body's pregnancy to like as a way to um, become a contraceptive.
So as for birth control methods, there are plenty. I don't know whether anyone does have any sort of information about them. Do you consider them to be equally effective? And have you heard about the time, the frequency of use of each, or the ease, or what do you think it's the most prevalent one, preferred by most people? Any idea?
Yes, IUD.
The IUD.
Yes, IUDs
Yeah.
is one.
I think more common for the pills are more common.
Pills are more common.
Mhm.
And about the efficacy, do you have any idea? Whether condoms are better or pill
Oh,
or IUD? Have you ever thought about
yeah.
Mhm.
It's a fact that we are all not like people have the same efficiency.
Mhm.
Yeah, so
Yeah.
some are better than some.
Exactly.
Mhm.
So when you want, when a woman wants, or any person with uterus, vagina, whole hormonal system wants to make a choice, it's better to be informed so that if she wants to choose one over the other, this decision is informed and this method is reliable and effective. Therefore, we are going to start with the one which is according to statistics and most healthcare providers' opinion, least effective one, spermicides, they comes in various forms. They come in forms of foam or gel or film or inserts, sponges, and yeah, gels I've already and creams. And what they do is sometimes changes the pH. This would somehow disrupt the motility of the sperm or the viability, but this is the least effective one, and it is recommended whenever somebody decides to use this, they should use another type of contraception with this because it's not effective and the duration of this and the frequency of its application totally changes the level of efficacy, especially if it is used alone. This is something that
So it's not like the best or most effective, but like it is an option there that you can get at pharmacies if you choose to. Right? And then, okay, and then we'll talk about condoms. I guess these will be very important since Valentine's is tomorrow. But yeah, so basically condoms, I think many of us know it prevents the semen from entering the vagina. And usually it's latex, but we do have the non-latex ones option. That's like an option for people who are allergic. And one thing about them, like, they're also helping to prevent against STIs. So that is something that's also important. Like the effectiveness is around like 85 to 98% effective. And one thing to note is that like the oil-based lube could damage the condom. So like it's best to get like a water-based lube instead. So like if you're like thinking that you can use like Vaseline to like use as a lubricant, you might want to reconsider because that might cause the condom to break. But yeah, so like does anyone know like what's the first step when you're like using a condom? Yeah, precisely. Yeah, and then like basically just like open it up and then like there's like two different sides. I don't know if
Yeah,
I should put it in front of the camera.
Okay.
Yeah, so like basically you have like two sides and then what you want to do is like just like slap it on the top and then like you can roll it down. This might be the opposite side. Yeah, this. Okay, and then basically you'll just fit on here and then you just roll it down.
Does anyone know how to tell whether it's right or wrong? Because if you do it wrong, then you've kind of ruined that one, right?
Yeah.
You can kind of look at the base and it's like on the inside, like the latex comes from the inside, then it's the right way. If it's coming from the outside, it's wrong. Does that
Okay.
make sense?
Some talk about a sombrero and
Yeah, exactly. That's what I
something
mean.
too. Yeah.
Mhm.
Also, is it important to spread that little bubble on top before you roll it down?
This bubble.
Right.
Yeah.
Before you roll it down.
So keep a bubble up at the top, right?
Yeah.
And then
Well, you want to
use
pinch
the
it
other hand
there's
to
a
roll.
bubble.
Lots of informed people.
Very. Does anyone want to like get their hands on it?
Yeah.
Oh, no. I'll pass this around if anyone wants to
Yeah.
try it out.
As a matter of
Probably in practice.
Okay, and then like when you're taking it.
Yes, well, the penis is vector from the bottom. And, yeah, it's harder than.
It won't roll off like
Yeah,
that.
yeah,
So
yeah.
you just kind of,
And
it'll
therefore-
slide off.
Exactly. Therefore, it's better. It's recommended for you to just try. And if you want to be discreet, you would use a tissue or napkin around it and put it in the garbage.
Not in the toilet.
Yeah, not in toilet. No. It's fine.
Okay, and then we'll move on.
Yes. As for medication, there are various types of pills. Comes in different types of packages, different numbers within each package. The one that is recommended to be used after in case of condom breakage or other incidents or unprotected sex of any kind. One brand is fine. There are different types of brands, and this medication is basically some sort of a progesterone. Comes either in a form of a 1 pill per pack or 2 pills per pack, and it's crucial to be taken within 72 hours after unprotected sex. After that, the efficacy of the pill would diminish, and it can be used as long after intercourse up to 5 days, but the best time is first 12 hours up to 72 hours. And if the 2 pack per pill, 2 pill per pack is purchased, the first one, as I mentioned, is should be taken with that amount, with that period of time, and the other one, and the next 12 hours, within the next 12 hours, should be taken. And yeah, that's about it. And it may give that person nausea or vomiting, and if that person vomits it within the first 2 hours of taking it, that person needs to take it one more.
And Plan B is available at the pharmacies here as well.
It's not over-the-counter medication, but it can be prescribed by a pharmacist or nurse or general physician or physician of any kind. Oh, the other one is a shot that, yes, called Depo-Vira. There are other types. There are other brands as well. It's also some sort of a progesterone, and 150 milligrams of this would help that person to prevent unplanned pregnancy up to 14 weeks, anywhere between 12 to 14 weeks. And at the first 2 weeks of getting the shot and the last 2 weeks of medication effects start wearing off, that person is recommended to have another method of contraception. And yes.
But don't they generally do it every 3 months? And they don't
yes.
have to do that?
Yes.
Yeah.
Exactly. 4 shots per year, and it is not recommended to use this longer than 2 years because of some sort of adverse effects. It affects bone density.
So not a very popular one
Mm.
for students to be taking, at least not recommended a lot at student wellness centers.
Exactly. The other one, sorry, is the progesterone only pills. These should be taken daily, and most preferably night, and most preferably within the same hour, like 9 p.m. every night. The more regularly that person takes it, the better it would affect that person. And yes, there are also same as the shot. It has some sort of an adverse effect like spotting, irregular menstruation, and other types of adverse effects as well.
So is this the one that you would take for 3 weeks and then take a break? And have your,
That one is monophasic, it would be a combination of estrogen and progesterone. This is the one progesterone only pill. It should be taken every day.
And, okay,
I think so.
that makes sense.
Does it? Any questions so far? Oh, this is the implant. It also release progesterone, but very, very slowly. It's implanted subcutaneous, like beneath the skin of the arm. And it has an effect as long as, I think, 3 years, if I'm not mistaken. And something about it is the ease of, because it's one-time insertion and protection for years. And for those who are not willing to take pills or shots or other types of contraception, that can be an option. Yeah.
Very new in Canada, and I think very promoted. Yeah,
Yeah, you can kind of feel like what it feels like under your skin. Usually that's the implant, like on the non-dominant arm. Just pass that one around.
Thank you. And yeah,
And then we have another hormone. And then this is another one where like this will be inserted into the vagina. It's the Nuva ring. Basically here's the vagina and then here's the cervix, and then the ring, if it was like two sides, it'll fit like somewhere, like it'll be like this. And basically it will just release hormones throughout the duration that you are putting it in. Like it does have like some side effects, like bleeding or spotting, or you might have like irritation. The way that it works is that it thickens the cervix mucus and then it changes the lining of the uterus. But this is reversible. So like after you take it out, you just won't work anymore. Yeah. And I don't think this is one of the popular options either, just because like this thing, you might just have to like constantly be aware that it's in there.
do you want to pass that around?
oh yeah.
Thank you.
This is another type of.
Does that not have any like long-term effects, or is it like?
Like it would have the effect like when it's placed in there. But yeah, like the effects they are reversible. So like once you take it out, then like you can just like revert back to like what was before.
Okay. Because it's like if it doesn't, then that would seem like not such a good method.
And
I think it's a good method. It's just not as popular as probably the long-term birth control methods.
Like the long-term one, maybe like the IUS.
the IUS is also another same method of release of progesterone, and this is one of the options that if a person plans to not get pregnant for quite many years, as long as 8 years of time, they can use intrauterine system. It also works as for IUDs, they don't release medication. This one does, and it should be inserted within the vagina by a healthcare professional like a nurse or a physician. And the same side effects that any progesterone containing pill or insert or shot has, this also can have on that person's body.
So it's not this whole contraption, it's just the little tiny piece up here,
We were kidding.
John.
I've heard stories and seen like videos of people who still had children, like even after the implants.
Yes. So as for protection methods, none of them is 100%, none of them. And the most effective ones will protect that person for example, 99% of time. And second of all, it's very important, especially when somebody wants to use them for the first time, the first few days, or even first few weeks, or when they are at the very end of that period of time that that method of contraception is considered to be effective. For example, when somebody used this after 7.5 or 7 years and 9 months, that type of method is going to lose its efficacy by passage of time. Therefore, it is better to consider having like another plan for contraception. For example, using this as well as a condom. Therefore, it's going to be more effective.
So you wouldn't put one in, a 2-year one in for 2 years and put another 2-year one and another 2-year one. Like you wouldn't do that for more than 8 years?
8 years.
This was 8 years.
This is 8 years. And for example,
Okay.
when it comes to 8 years and 10 months, and or 7 years and 11 months, it's better for that person to start consulting their physician or that healthcare practitioner, because it's going to lose its efficacy.
Right, but could you put another one in after that 8 years?
Yes, of course.
Okay,
Yes.
is that what kind of what you were asking?
Oh no, I was just asking about like how what's the word? Efficacy.
Yes,
Yeah.
efficacy.
How
Yes.
high is it?
Yeah, even the most effective ones are not 100% because everybody's body different, and usually when they say it's going to be effective for 12 weeks or for 10 weeks, it's the average of all the persons that medication has been studied on, but it's not a rule for everybody. For some people, the efficacy may go longer, and the drug might be effective for longer period of time. For some people, yeah, shorter. Therefore, yeah, at the beginning and at the end, they need another method.
Yeah, and just going off of the IUS, that one has like hormones in there, and then like if you're looking for the one without any hormones, like there's like the IUD, like the intrauterine device. Like this works by like creating like inflammation within the uterus to prevent like the what was it?
The release of egg, and also it would be difficult for the sperms to reach the eggs once it's released from fallopian tube. As for inflammation, the endometrium gets thicker and the immune cells are recruited to that place of inflammation, and it would help to prevent pregnancy.
Yeah, and this is made out of copper. Okay, I'll just pass this one around. It is also reversible, so like if you like take it out, then the effects will not be there anymore. But when you have it in, it is 99.8% effective. It can be used as an emergency contraception within 5 days after unprotected sex. And yeah, and some of the side effects might include like increased menstrual bleeding and cramping, or like headaches, abdominal pain. So yeah, before inserting, you would like consult your healthcare provider to see if like this is something that you would want to have. Like this is a long-term kind of protection. So
As for pills, they comes in various types and shapes. Yeah, thank you. And you might have seen 21 pill per pack, 28 pill per pack, 84 pill per pack. What's important is that most of them are categorized into monophasic, biphasic, triphasic. Those with triphasic or those which are triphasic or biphasic, they mimic the levels of estrogen and progesterone more closely than monophasic, and most of the time there are 21 pills within a pack with active pharmaceutical ingredients. And if you see a pack with 28, usually the last 7 pills are inert. They doesn't have any active pharmaceutical ingredients. They just help that person to remember to take them every night, because for some people, it's hard to have it in their mind while they are discontinued taking the pills so that they can have their own natural period or menstruation. And that's about it. Yeah. They also have some adverse effects like nausea or breakthrough bleeding or vomiting or yeah, acne. It's better to always consult your healthcare provider once you want to take, once somebody wants to take it. And there are transdermal patches. Each patch would sustain for 7 days. Therefore, per month or per one cycle, a period cycle, that person would need 3 patches, and they can be applied anywhere in shoulder or in upper arm or but as I was informed by Rita, apparently in cities like here in Saskatoon, when the weather is really cold, the patch won't stick as closely, and it won't last for 7 days on person's skin. Therefore, for those who reside in cold cities,
Not a very
recommended.
popular one here, is
No.
what
Yes.
we found.
Yeah, and like we've been talking a lot about the contraception options for female, and then I just wanted to like add a little bit about like male contraceptives, and like there aren't that many options. Like the ones that we probably all know are like probably condom, but also like withdrawal is just it doesn't really work. So, but the one that is available right now is male vasectomy, which is like you would surgically sever the tie or tie the vasa differentia, so like then the sperm produced wouldn't be ejaculated after the procedure. That process it is irreversible. Like for the male, like you would be able to like have an erection and also like ejaculate, but then like you wouldn't be having any sperm in the ejaculation. That was the idea behind vasectomy. Um, so yeah, there are others that are in clinical trials right now. So like for example, there is one that is hormonal. It is like the nestrone, so NES and testosterone combination. So that one, it is a gel where like you can just like smear onto your skin, and then that works as a male contraceptive. That one, it is currently being tested, so we'll hear more about it in the future.
They're also researching like pills.
Yeah, a lot of like
Yeah.
different medications coming their way.
So just a few more minutes.
Oh yeah, and then I'll just quickly go over like the pregnancy test. So like 2 lines, it works. Like it works by like if you see 2 lines, then like you would know that you're pregnant. And this is very like so like it tests for like the human chorionic gonadotropin. So like this is like something like a hormone that you would produce like after implantation and the development of the placenta. So like if you detect the 2 lines, chances are that you are pregnant. So yeah, and you can get the pregnancy tests at the pharmacy shops. And so like some of the options that we have on campus is like the student wellness center nurses. They are very happy to talk to everyone about the different options of contraceptives, like in way more detail than what we can do today. So like if you are like at any point concerned or want to know more about anything, so you can just like book an appointment with them to talk more about it. And yeah, and then just the plan B is available at the pharmacies. And that's everything.